Welcome back to Money Smart Basics. Alfonso here. If you're over 60, approaching retirement, or helping a loved one navigate Medicare and Medicaid, this video is for you. Let's simplify what these programs are and how they really work. Most people use Medicare. Millions rely on Medicaid. But almost nobody understands how we got here, or why it's so confusing. Back in 1965, President Lyndon B. Johnson signed two programs into law that would change healthcare in America forever: Medicare and Medicaid. At the time, seniors couldn't get affordable insurance. Private companies either charged too much or denied coverage altogether. So the government created two systems: Medicare, for people 65 and older; Medicaid, for people with limited income. Here's where the confusion starts. Medicare is federal, which means it's the same across the country. But Medicaid is run by each state. That's why some states use different names. For example, California calls it Medi-Cal. Massachusetts calls it Mass Health. Different names, but the same core program. Now that you understand the history, in this video, we'll break down Medicare step by step and show you what it really covers and what it doesn't. If you think Medicare covers everything, you might be setting yourself up for a financial surprise. Medicare is the primary health insurance for most Americans after 65, but it's not just one simple plan. It's made up of four parts. Part A covers hospital stays, skilled nursing care, and hospice. Most people receive this without a monthly premium. Part B covers doctor visits, outpatient care, and preventive services. This part does require a monthly premium. Part C, also known as Medicare Advantage, is offered by private companies. These plans bundle Parts A and B and often include extra benefits like dental, vision, and prescription coverage. Part D helps cover the cost of prescription drugs. Here's what many people don't realize. Medicare does not cover everything. There are still deductibles, co-payments, and coverage gaps. That's why many people choose additional coverage. Let me say this clearly. One of the biggest financial risks in retirement is something Medicare does not fully cover. Medicaid is often misunderstood. Many people believe it's only for low-income individuals, but it serves a much broader purpose. Medicaid is funded by the federal government, but managed by each state. That means the rules, benefits, and even the name can vary depending on where you live. Medicaid may cover doctor visits, hospital care, home health services, and nursing home care. Here's the key difference. Medicare is based on age. Medicaid is based on income and financial need. And here's the truth many people discover too late. Medicare does not cover most long-term care. Medicaid does. And long-term care can cost thousands of dollars per month. This is why planning ahead is so important. What if I told you some people have both Medicare and Medicaid and pay very little for health care? These individuals are known as dual eligible beneficiaries. When someone qualifies for both programs, Medicare pays first, and Medicaid helps cover additional costs. That can include premiums, deductibles, and co-payments. This combination can significantly reduce out-of-pocket expenses. But many people miss this opportunity because they don't understand how the system works. They assume Medicare is enough, or they wait too long to plan. Here's the truth. Healthcare is not just a medical issue. It's a financial strategy. If you don't prepare for it, it can take everything you've worked for. But if you understand how these systems work, you can protect your income, your assets, and your future. Let's slow this down and make it very simple, because this is where most people get confused. How do these programs actually work? And more importantly, who qualifies? Let's start with Medicare. Medicare is primarily based on age. If you are 65 years or older, you are generally eligible. But that's not the only way. Some people under 65 can qualify if they have certain disabilities or specific medical conditions. Now here's something very important. Medicare is not based on your income. You could have a high income or a low income and still qualify for Medicare. What matters most is your age and your work history. If you worked and paid into the system through payroll taxes, you've already been contributing to Medicare. That's why many people receive Part A without a monthly premium. Now let's talk about enrollment. Most people sign up around their 65th birthday. This is called your initial enrollment period. If you miss that window, you could face penalties that last for the rest of your life. So timing matters. Now let's shift to Medicaid. Medicaid works very differently. It is not based on age. It is based on financial need. That means your income and your assets determine whether you qualify. Each state sets its own guidelines, so the exact limits can vary depending on where you live. In general, to qualify for Medicaid, you must have limited income, limited savings, and in some cases, specific medical or care needs. This is especially important for seniors who may need long-term care, because as we mentioned earlier, Medicaid is the program that can help cover those long-term care costs. Now here's where it all comes together. Some individuals qualify for both Medicare and Medicaid. These individuals are often referred to as dual eligible. This usually happens when someone is over 65 and also meets the financial requirements for Medicaid. When that happens, Medicare acts as the primary insurance, and Medicaid helps cover additional costs. That can include things like premiums, deductibles, and co-payments. For many people, this combination provides significant financial relief. But here's the key. You don't automatically get both. You have to qualify. And that's why understanding how these programs work is so important. Because the difference between knowing and not knowing could cost you thousands of dollars in retirement. Let's talk about something that doesn't get enough attention: the future of Medicare and Medicaid. Because while these programs are essential, they are also under pressure. And if you're planning for retirement, you need to understand what's changing. First, let's talk about Medicare. Medicare is funded primarily through payroll taxes, premiums, and federal spending. But here's the challenge. As more people retire and fewer people are paying into the system, the financial strain increases. Every year, millions of Americans turn 65 and enter Medicare. At the same time, healthcare costs continue to rise. This creates a growing gap between what the program takes in and what it pays out. Now let's talk about Medicaid. Medicaid is even more sensitive to funding changes because it's a partnership between the federal government and the states. When federal funding is reduced, states often have to make difficult decisions. That can include reducing benefits, tightening eligibility requirements, or limiting provider access. And that directly impacts the people who rely on it the most. Now here's where federal cuts come into the conversation. At different times, policymakers have proposed reducing Medicare spending, changing reimbursement rates to doctors and hospitals, or restructuring Medicaid funding into block grants. What does that mean for you? It means the system could change, and those changes could affect what's covered, how much you pay, and what services are available. So the real question becomes, what should you do about it? First, do not assume these programs will cover everything you need. That is one of the biggest mistakes people make. Instead, build your retirement plan with healthcare in mind. Second, focus on building your own financial cushion. That includes savings, emergency funds, and additional income streams. Because the more control you have over your finances, the less dependent you are on changes you cannot control. Third, stay informed. These programs evolve over time. Policies change, benefits change, eligibility rules can change, and the people who stay informed are the ones who make the best decisions. Fourth, consider professional guidance. A licensed advisor or planner can help you understand how Medicare fits into your retirement, what gaps you may need to cover, and how to prepare for long-term care. Let me leave you with this. Medicare and Medicaid are important, but they were never designed to carry your entire retirement. They are part of the plan, not the whole plan. If you understand that and you prepare accordingly, you put yourself in a position of strength. Because at the end of the day, it's not just about qualifying for benefits, it's about protecting your future. So take the time to learn the system, ask questions, and make sure you're positioned the right way before you need it. Because when it comes to healthcare after 65, preparation is everything. The information provided in this content is for educational and informational purposes only and should not be considered financial, legal, or tax advice. Always consult with a qualified financial advisor, tax professional, or legal counsel before making any financial decisions. The creator of this content is not responsible for any actions taken based on the information provided. Investments and financial decisions carry risk, and past performance does not guarantee future results.